IVF Real Talk.
I'm Lucy.
And I'm Yael. Welcome back, guys. Today we have Dr. Anthony Marren joining us, a fertility specialist from Genea. Welcome.
Thank you very much.
Today we're talking about all things egg freezing, what's involved, when to consider it. Dr. Anthony, the Medical Director of Genea CBD, is going to guide us through it.
Yeah, I'm looking forward to it. But before we do, Dr. Anthony, we were just talking about our new segment that we do, the 3 fun facts from ChatGPT.
Lucy's favourite
let's start
segment.
off with the first one. So ChatGPT said Dr. Marren loves baking and has mastered the art of a sourdough loaf, which is honestly quite impressive.
I saw this and I was like, wow, I love sourdough, but I don't have the patience to make it. So I'm like, if this is true, I'm impressed.
It's true, yeah. So I started baking a couple of years ago now, and I've got a couple of starters on the run.
Wow.
And I normally bake a couple of loaves each week.
Nice.
What's the time frame from start to finish?
You basically quieten the starter down by putting it into the fridge, and then basically when you want to bake, you've got to bring it out and you've got to feed it twice. And that sort of will usually take about sort of 12 hours. And then once the starter's really sort of nice and bubbly, then you can sort of use it. And then there's probably about another 12, 18 hours of prep before you're baking.
Wow.
And it really sort of depends on the temperature. So in summer, it's a lot faster, whereas in winter it's sort of slower.
Oh, sounds like the IVF process in the lab.
Yeah.
12 hours here, temperature controlled. There's an art to it.
Yeah, so...
Oh, that's impressive.
Yeah, so it's quite funny. My wife often sort of says that my starter is more important than my children. So I'll often turn the fireplace on to get the starter and
cook up the house.
And the dough nice and warm.
Oh,
I love
nice tonight, actually, this weather.
Oh, but I love sourdough, so yeah, I might have to put some orders in and just get you to make them. Tell the kids I'm sorry in advance. Okay, so the next fun fact we have, so ChatGPT also follows your travels.
Right.
You've been to New York.
Yes.
You went to see Professor Philip Lai, internationally recognised for male infertility surgery, the microsurgery. Is that right?
Yeah, it's a bit scary about how much ChatGPT knows, to be honest with you.
Knows where you've been.
It's like a stalker. Yeah. So I actually went to New York about 10 years ago, and we did a basic male microsurgery course sort of back then, and went back earlier this year, and we did their advanced microsurgery course. So there's a week-long course, and it's in regards to like vasectomy reversals and what we call a testicular microdissection, where we use an operative microscope to look for sperm within the testes when the sperm count is extremely low.
Wow.
Is that the microtesi
That's what
we
I was
hear?
going to ask.
Correct.
Yeah.
Yeah,
Okay.
it is. Yeah. So, so over there, they've sort of, I suppose they've been at the forefront of this sort of procedure for quite a while. And they have a really nice laboratory sort of set up, so it's really good from a training perspective.
Yeah, because there's not that many that do it here. Is that right? It's not as.
Is there only a couple in Australia?
Yeah.
So you usually sort of find that in each of the major sort of cities, there's usually sort of 1 or 2 sort of people that do it.
That's cool. That's really cool.
That's really cool.
And lastly, ChatGPT has said Dr. Marren is very good at keeping his personal life private, but based on his surname, we're guessing there might be some Irish roots in there.
Yeah, it is Irish. Yes.
Wow, go
I love
it.
ChatGPT.
ChatGPT is good.
3.
Mind you, if I put my surname in, ChatGPT would also think it's Irish, but it's not.
Really?
Yeah, Hannah with the apostrophe. I always get asked, are you Irish? And I'm like, no, they just put the apostrophe in by accident when we moved here from overseas, and it's quite funny.
Cool. So were you born here or back in Ireland?
Yeah, I was born here. My parents were born here, so it's grandparents.
Nice.
Okay.
Aww.
Have you been?
Yes, I only once have I sort of been back. So we went there 30 years ago for our honeymoon.
Long time ago.
And it looks picturesque. It looks beautiful.
Yeah, it was. Yes.
Okay. So now we'll hand it over to you to tell the listeners a little bit about yourself and how you ended up in the IVF space.
So I suppose you often sort of find when you ask sort of doctors as they're sort of going through why did you end up here or there, and it's often our mentors, to be quite honest with you. Like I probably went into medicine and started off as a junior doctor thinking I was going to actually end up doing cardiothoracic surgery, but I really enjoyed my last sort of term of obstetrics and gynae in my final year of medical school. And there was just something about it that I suppose just kept me interested. So I ended up doing some extra sort of O&G as a quite a junior doctor and loved it and essentially never sort of left. And so I was an intern and resident at Gosford. And so I ended up then starting my formal obstetrics and gynae training at Royal Prince Alfred Hospital in Sydney. I ended up doing the Masters of Medicine in Reproductive Health and Human Genetics. And at that stage, one of the people that were leading that was Professor Jansen, who really started Genea, or what was called Sydney IVF back then. And again, he and some of the others like Ian Fraser and that, again, were just really quite inspirational. And I just sort of found it sort of quite fascinating. And so as I was just going through my obstetrics and gynae training, I just gravitated towards doing fertility. And I suppose it's just a really nice part of medicine. It's a nice balance of medicine, balance of surgery. And I think ethically there's lots of challenges with it, which is actually, it's quite good to be sort of challenged and, not just do the same thing over and over again. And it's also an area that's really progressive as well. So it's a lovely area of medicine to work in.
Yeah. I was so thankful for all the doctors that work in IVF.
I was going to say, it's also special. Like you're creating
miracles every day,
lives,
so
making people's wishes come true. So we're a bit passionate about that. We wouldn't have our little ones without you guys.
Yeah, that's for sure.
Yeah. So should we get started?
Yeah, sounds good.
Talk about all things egg freezing. Okay, let's go. Question 1. Is there a difference in the process for someone, say, in their 20s versus their 30s or 40s for egg freezing?
So in the actual sort of cycle per se, there's not that big a difference. It's more, I suppose, in relation to the counselling and I suppose the success rates. And that's similar whether or not you're egg freezing or whether or not you're doing IVF with a view to achieve a pregnancy. And I suppose it sort of comes back to this whole concept of ovarian reserve. And I suppose ovarian reserve is two things. There's the quantity or the numbers of eggs, and then there's also the quality of the eggs or what's the real potential that those eggs will give rise to a successful ongoing pregnancy. So from a quantity perspective, we basically sort of know that the peak number of eggs that a sort of a female has is actually prior to birth. And at birth, a female will come down to about 1 million eggs in the ovaries. At the time of puberty, so 12, 14, she'll come down to about 500,000. So she actually loses half of those eggs even before she's had her first period.
Wow.
Female will sort of ovulate about 400 to 500 times in a lifetime and will go through menopause when there's fewer than 1,000. And the average age of menopause is 50, but there's a really big range of normal. And so the normal range of menopause is anywhere from 45 to 55. And essentially how a woman goes through so many eggs so quickly is a woman just isn't releasing one egg each month. She's releasing a whole bunch of eggs in these little tiny cystic spaces called follicles, which we can sort of count when we sort of do an ultrasound. And they're ultimately the sort of follicles that we recruit with our medication. So obviously as a woman gets older, whether or not they're doing IVF or egg freezing or IVF to achieve a pregnancy, then the numbers of eggs that we're likely to recruit with our medication is going to get less, when you compare 20s, 30s and 40s. The other thing that's probably more important is the quality. And unfortunately, as a woman gets older, the quality of the eggs does deteriorate. And I suppose the biggest measurable thing that we can do is when we look at what's the rate of a chromosome error in an embryo. So in our young population, so where the female is less than 35, we find that about 30% of the embryos will just have a random chromosome error. At 40, that number's about 50 to 60%. And then at 43, that number's quite high. It's about 80 to 90%. And so you can sort of see that as a woman gets older, if the rate of chromosome error sort of goes up, then it becomes a lot harder to achieve a pregnancy naturally and also with IVF. And the miscarriage rate is obviously also going to be sort of much higher. And so I suppose in practice, if you're trying to sort of do egg freezing and you're trying to sort of say, well, how many eggs are you wanting to achieve? It's a bit cruel because as you get older, we're going to collect fewer. But in actual fact, we need more because a greater proportion are going to be abnormal. And so the process, as I said, in terms of like the injections and the scans and the procedures aren't going to be any different, but it's the counselling in regards to what the woman is really trying to achieve and how many eggs we're really trying to sort of get in storage. And it's really important that she sort of understands a realistic likelihood of success.
Yeah, that makes sense. I didn't realize it was so high. Like I was 43. Yeah, like I was 43 when I had my success. So I'm already, we just said it earlier that I already feel like I won the lotto. But like it sounds like I really won the lotto. Like
yeah, that's right.
The odds was like for the chromosome piece that you mentioned was at 80%. Like that's huge. My odds were so it does explain the journey to get to that one. But interesting.
And just on that, how do you determine how many eggs someone should aim to freeze? And what should that number be? Do you have like a personal preference with your patients?
So I suppose with egg freezing, there's two main types. So there's, I suppose there's medical and then non-medical or elective egg freezing. And so medical, we're doing it for a specific reason. And so it may be that, someone's got a diagnosis of cancer and they're going to get chemo or radiation, or they might have surgery on an ovary. Or there's basically something that's going to jeopardize that person's fertility moving forward. And so in that situation there, we're often trying to get in a cycle or cycles prior to treatment. And so often it's a bit of we try and get what we can basically. Whereas obviously in the non-medical space or the elective egg freezing space, then it's a bit more of a discussion in regards to, I suppose, what would be an ideal number to sort of achieve. And I suppose the things that I always ask patients to consider is I suppose, what is their ideal family size? Because if someone's like, I've only ever wanted one child, then I suppose the numbers of eggs that you're going to try and achieve is potentially going to be less than someone who is really keen on a large family. Also, I suppose the social circumstances. So some people might be like, I don't have a partner and I, don't necessarily see a partner that I'm going to have children with, coming into my future in the near future or anything like that. Whereas some people might be like, well, actually I do have a partner and we might start to try and achieve a pregnancy in 6 months. And so everyone's social circumstances are different. And you also get some people where they're like, I'm not even sure I want to have children, but they kind of feel like they just want to do one cycle just so they can tick that box and move on. So it's a real discussion about, I suppose, what the woman's trying to achieve and what their social circumstances are. Then I suppose you need to look at, well, what's the woman's ovarian reserve? And we check that via the blood test, the AMH and the follicle count. And I suppose how many eggs are we likely to get in an IVF cycle? And so, for instance, if you think that someone's ovarian reserve is really high and you're going to get large numbers of eggs, like, you think you're going to get, say, 20 eggs per cycle or something like that, then you might be able to achieve certain egg numbers with relatively small cycles. Whereas if someone's ovarian reserve is very low and you think you're only going to get 2 eggs at a time, then aiming for 40 eggs may be completely unrealistic. So you've got to sort of take a lot of those things into consideration. In regards to egg numbers and success rate, the data that we have is not fantastic. So a lot of the data that's out there is based on mathematical modeling, as opposed to actually women that have frozen eggs and then have definitely sort of come back to use them. And the paper that I sort of tend to refer to a lot is the main author is someone by the name of Cascante. And essentially it is actual data where people have frozen their eggs, they've come back to use them, and it's actually sort of documented what the success rates are according to a woman's age and the numbers of eggs that were actually sort of thawed. And so I normally sort of sit down and sort of go through that so that they have a very clear view in terms of exactly what the likelihood of success is. And what I will often sort of say is it's worthwhile doing a cycle and then regrouping after that, because as you guys know, if you've done IVF, IVF is emotionally, physically, and financially challenging. And so someone might sort of come into this thinking, I'm going to do 3 cycles and I'm aiming for this number of eggs, but they might find the cycles incredibly tough and they might be like, after 1 cycle, I'm done. Whereas you get some people where they do it and they're like, oh, it's actually not as bad as I thought. And so they're a bit more open to doing more treatment. So it's not an easy decision in terms of the numbers of eggs, and you've got to take into a lot of things into consideration, including how they go in that first cycle and how they found it.
Yeah. I actually like the fact that you didn't say we should be aiming for this number of eggs, because I think that can put a lot of pressure on us. And like you said, keep it a little bit more relaxed. Let's see how you go on the cycle.
Yeah, and also to factor in the emotional roller coaster that comes with it. You're right. Some people, my cousin did egg freezing and she found it less taxing than doing a full cycle of IVF, which she went back to later. So yeah, you're right. I feel like some people take it a bit better than others. And I think just testing the waters, like you said, and not setting an expectation of we need 4 rounds. And, there's the financial pressure as well as the emotional pressure. I think that's really smart.
Yeah, good way to look at it.
Yeah.
It's often hard to predict how people are going to find it as well. So, like,
you can't be prepared for IVF.
No.
We know. Absolutely. Yeah. We all thought we could. And nothing prepares you.
That's so true.
No amount of advice can prepare you for it. You're right. In light of all of that, if we were to take out the medical piece that people might need egg freezing, what's the ideal age for egg freezing?
So obviously younger to some degree is better, in as far as, the younger the eggs, you're likely to get more eggs. They're going to be a better quality eggs. And therefore the success rate is obviously going to be higher. I suppose the only thing to say is that if you do it really young, like let's say you try and promote it in people who are 25 or something like that, then you're going to end up with a high number of people they go freeze eggs, but will never actually need to use them. Yeah. And so there is that sort of balance there. And there are some studies that have tried to look at what is the ideal age. And some of the numbers actually sort of suggest around about 35, 37 in terms of trying to balance success and likely to sort of come back to use them and try and balance it from a financial perspective. Now, I'm not necessarily sure I would sort of really suggest pushing it to sort of 37, but certainly probably somewhere in that early to mid 30s is probably the ideal. For me, I think once someone has made the decision that, yes, they're going to do it, then it just makes sense to try and do it sooner rather than later. And also, if someone's going to do more than 1 cycle, again, if they don't need to do it, immediately one after the other. But again, try and do it sort of sooner rather than later, just from an egg quality and success perspective. But it is that balance, because as I said, you don't want to push for it too early, because obviously, if there's just a high chance that someone will never actually need to actually sort of utilize those eggs, and you're pushing an invasive treatment that may never be used.
Yeah.
Yeah, it's such a sweet spot. I never thought about it like that. I always thought younger better, but it makes sense. If they're not going to utilize it, then
you may not need it.
Yeah.
I feel like the next question we've kind of covered. But maybe I can change it. Maybe in your experience, what is the average age of your patients coming to talk about egg freezing? And when, like, I know you said early 20s might be too young, but do you see more 35-year-olds or earlier, older?
Yeah.
And is there an actual cutoff? Because I know with IVF we say around about 45 years of age. Is there a cutoff for the egg freezing?
Look, there's no cut off as in like where you can't do it. But certainly, again, like in the mid 40s, you'd spend a lot of time actively trying to discourage someone from going down that path. I suppose you do see a fair proportion of people in their sort of mid 30s, and so that is a big sort of cohort. But we do also get people sort of 42, 43 that are sort of doing it. And it's hard, and you do end up spending a lot of time sort of talking about sort of success and things like that. But for some of them are a bit like, it's something that they feel like they really sort of need to sort of do. And so they may not necessarily do a lot of treatment, but they often just feel like they need to do a treatment cycle. And they're a bit like, I may not even use these eggs, but if I want to use those eggs in the future and I've sort of done the cycle, even if it doesn't work, they sort of feel like they've done what they can. So, and I think that that's also important, because essentially sort of making sort of decisions about their reproductive sort of future. Whereas if you just sit there and say no and you take that decision making away from them, then that's obviously not fair.
Yeah, I feel like that would be me. If I hadn't found a partner and I got to 35, that would be the age for me. I think maybe that is such a common age because we get told at 35 your fertility starts to decline in society. You get told that a lot. So I wonder why if that's...
And I was going to ask as well, I was wondering, like, times have changed since... For me, there wasn't much talk of egg freezing, whereas I feel like now it's spoken about and
it's trending.
Yeah, it's trending. And like I was wondering, are you seeing girls in their 20s or late 20s just thinking, okay, well, let's, do this so that I've got that security and I can go back to my career and my life and it's there.
Yeah. So I do a fair amount of egg freezing for medical reasons. So I also have a public appointment at Royal Prince Alfred Hospital. So we see a lot of oncology cases through there. So most of the very young ones, there's usually a medical indication for it.
Okay.
I think most of the elective or the non-medical ones, the vast majority are sort of in their 30s. I suppose what we are seeing, which is good, is we're seeing more younger people with sort of significant endometriosis looking at freezing their eggs, either because they've had surgery or they may need repeat surgery and things like that. So I think there is a bit more of an awareness, and so some of the younger ones are coming forward more for underlying medical reasons as opposed to anything else.
Okay. That makes a lot of sense.
Yeah, that's cool.
Yeah.
Okay, so the next one we've got, are there any exciting developments in egg freezing technology that people should know about?
Yeah, so, and look, both of these are a little way off, so they're not here now and they won't be here tomorrow, but they're...
Watch this space.
Yeah, watch this space. So where we really struggle with egg freezing is that if someone's doing IVF and they're bringing egg and sperm together fresh, we get an idea of what their egg quality is in terms of how the embryos develop. And so, women will sort of know the outcomes of the cycles fairly sort of quickly. the problem with egg freezing is someone can do 1, 2, 3 cycles of egg freezing and they can get a lot of eggs sort of stored. But what we can't tell them is, those eggs, are they nice eggs that have a high probability of achieving a pregnancy? Or are they poor quality eggs and they may not amount to anything? And often the first time that we get to know anything about this is when we come to utilize the eggs. And what we're sort of lacking is we're lacking a test that tells us about egg quality. And so, for instance, with all of our ovarian reserve testing that tells us about numbers, we know it's not very good at telling us about egg quality. It's not good at telling us who will or will not fall pregnant. There is tests of sperm quality, so the sperm DNA fragmentation test that sort of exists. But obviously, when we do that test, we're destroying sperm, whereas obviously we can't go and destroy the eggs because they're so hard to actually sort of collect. So there are some groups looking at artificial intelligence, looking at the appearance of eggs to try and give some kind of score, if you like, in terms of egg quality. As I said, it's not here now. Well, it's here now and it's been offered overseas, but it's not. The validation is still a bit sort of questionable, and it is something that we are sort of actively sort of looking at, because I said it would be really nice to be able to sort of say to people, these are really good quality eggs, high probability of achieving a pregnancy, or, hey, look, we actually have some concern about these eggs. The second thing about egg freezing, which I think will hopefully be on the horizon, is that, and again, with any IVF cycle, obviously when we collect eggs, we collect some mature eggs, but a lot of the times there's also some immature eggs that sort of come out as well, just because they come out of the smaller follicles. And some people struggle where they have a really high proportion of immature eggs. And so we are sort of looking at, are there sort of techniques, egg maturation techniques that we can use in the laboratory to try and sort of mature some of those immature eggs, so that basically will just increase the cohort or increase the number of eggs that ultimately can be used sort of down the track. But again, that's something that we're not doing now, but hopefully that will be in the pipeline.
Wow,
exciting.
This is so exciting. I think both things, yeah.
Yeah, agreed. And I also learned something new. I didn't know that the DNA fragmentation test ruins sperm.
Yeah.
Did you know that?
I guess because it's taking the sample, right? But you can't just give your eggs away to get tested because you're going to need them.
I get that, but I didn't know that because both our partners went through it, and I just didn't think of that.
Yeah, how do they actually do the test? Now I need to know. I need a visual.
I just set Lawan
Are they
off.
lasering it?
There's a few different types of DFI tests around, but once you send it through the machine,
I was going through a machine.
you then can't use it at the end.
Wow.
Yeah, so it's just a sample that's gone. Okay, yeah, I get what you're saying now.
Yeah.
Wow, that's
And yes,
interesting.
obviously we can't do that with eggs because we want to keep them.
Yes.
Yeah, that's right. That's right.
I think it would be so cool to find out about the egg quality, because I think that's something a lot of us talk about.
That would have saved me
We
years.
want to know our egg quality, especially for those females going through unexplained infertility.
Yeah,
Yes.
absolutely. And
don't have any
over
answers
40,
on
like
that.
if you're starting over 40, like you said, your odds, and that was me, were stacked up against us. So I feel like for the older generation,
And
that's
even to
definitely
see if lifestyle factors are actually improving egg quality.
Yeah.
That would be so cool. So hopefully soon, fingers crossed.
Yeah.
That's really exciting though. My next question, how do you respond to patients who say, I'll just wait until I'm ready to do egg freezing?
So obviously, like, the decision to do egg freezing or IVF for any reason is obviously very personal, and so people have to be happy with the decision that they make. And I don't think anyone should feel pressured. And I think you've got to be very careful of choosing your wording. Like, I've had patients that have come for second opinions where I've had one patient that sort of said that the person they saw made references to, like, the mother would be wanting grandchildren and things like that. And I just, you can't just...
Don't say that.
we get that pressure already from the mother.
Yeah. But say if the patient did want to do egg freezing, but she was like, I'll just wait until I'm ready. Say that was the scenario.
So I think it's an education point. So I think you've got to look at, what's the person's age, what's their ovarian reserve. The patient needs to understand exactly what's involved in the egg freezing cycle. And I suppose they need to understand, well, what do the success rates look like now if they did it at what their age is now versus in another 5 years or something like that.
And 10 years and so on. Yeah, that's true.
And I think all you can do is just try and be as factual and basically just work out what information they need to make a decision and just give it in a very unbiased sort of way. And then people just need to think about that, and then they need to then make a decision that's sort of right for them. And you get a lot of people where they'll come and sort of see you and they might sort of disappear for sort of 6 months and then come back for another conversation. And often people just need a bit of time to sort of think about it.
Yeah, that's true. I feel like egg freezing has got a bit of a bad rap on social media of recent, where people share their story and they say it didn't work for me.
Yeah.
But I feel like we need to get some more of the success stories out there.
Yeah,
which
absolutely.
I guess it's hard because it is still quite a new thing. Like you said, it's hard to measure with people
and the turnaround. Yeah, that's right. Are people coming back to use them? And then there's a gap, so it's hard to sort of capture that success.
Yeah.
Okay, the next one. What advice would you give someone who's weighing up whether to make embryos with their partner or just freeze their eggs?
This is a good question.
Yeah.
I'm interested to know the answer of this one.
And I also, we sort of go through this also when women who have sort of frozen their eggs and they've sort of then come back with a partner and it's like, well, do I use my frozen eggs or do I do a fresh cycle or what do I do? So essentially what I say is that eggs belong to the woman and she can do whatever she wants with those eggs. And she's the only one that needs to consent in order for them to be used or discarded. Embryos belong to the couple and both need to consent in order for them to be used or discarded. And so I suppose if a woman has embryos stored and something happens to the relationship, then the most likely scenario is those embryos can't be used. And, I have had some people, for instance, that have done, they've done embryo creation from a fertility preservation perspective, and then their relationship has broken down. And so they've ended up in a situation where, there's embryos there that can't be used, which is obviously incredibly sad. Now, from a medical perspective, embryos do have some advantages over eggs. So an embryo is over 100 cells. And we're happy if any more than 70% of those cells survive the freeze-thaw process. And so the vast, vast majority of our embryos do survive and are able to be used. And the cells that do die, they just get excluded. And the cells that survive, they just continue to divide and they just replace the ones that died off. An egg is just a single large cell full of water, basically, and it doesn't survive as well as an embryo. And because it's a single cell, it can't 70 or 80 or 90% survive. It either survives or it doesn't. And so we find that the survival rate is somewhere between about 80 and 90%. The other thing about embryos is an embryo has been fertilized, it's started to divide, and it's got all the way through to day 5. So we're a lot more confident about giving statistics, I suppose, in the probability that this embryo will give you a live birth as opposed to these eggs. So they're the two sort of advantages of embryos over eggs. It's really important that patients understand that balance of the medical and the social or legal aspects. And again, people need to sort of make a decision based on what's right for them, and only they know their social circumstances. And sometimes we might get people that may do a bit of a combination. So if someone's got to get a really large number of eggs, they might split. So they might do half eggs, half embryos. Or you might have some people that might do 2 cycles. They might do a cycle of egg freezing and then a cycle of embryo creation and freezing.
Yeah, that's really interesting about I didn't realize that some of the cells can die from the embryo if it's about 30% and it's still okay to be used, but with an egg it's very different. I had no idea about that.
Yeah, me neither. That's
it makes sense because, like you said, the egg is water.
Yeah.
Compared to the embryo
and
is
just one. Yeah.
Wow, that's really interesting.
Yeah, and I guess that's where your probably then having conversations with the patients that if you're ready to have a baby now, then potentially embryos is what you should be doing.
Yeah.
And then, you could freeze after if need be. But it really depends on what they want. If they're doing it for preservation, then that's different. Whereas if they're wanting a baby, then obviously an embryo's better than freezing eggs.
So if someone's wanting to fall pregnant now, you would definitely do embryos.
Yeah. With the embryo thawing process compared to the egg, so the egg has an 80 to 90% chance to thaw, and the embryo is 95. Is that correct? Have I got that correct?
Yeah, look, we quote 95. It's higher than that, so it's very it's rare that an embryo doesn't survive the freeze-thaw process. Like it does happen, but it's uncommon.
Okay.
Whereas with an egg, like as I said, it is usually around about 80 to 90%.
That's good to know. That's actually really reassuring, I believe.
Yeah, I agree. Absolutely.
Yeah.
Okay, the next question. I love this question. If someone could only focus on one lifestyle change before egg freezing, what would it be?
Look, obviously there's the general stuff like being, in a healthy BMI through diet and exercise, and obviously not smoking and limit alcohol and things like that. But I think for egg freezing, the thing that I hear the most is that an IVF cycle is not easy, especially when you're trying to navigate it by yourself.
Yeah.
So because there's not a partner there to sort of help you, or there's not someone there to watch you do the injections or do the injections for you, or someone to remind you to take your trigger, or just someone to bounce things off. So I often sort of find that the thing that people sort of struggle with is that they're doing it sort of by themselves, and they're not necessarily telling lots of people that they're doing it either. And so it's quite sort of isolating. So I think probably the thing that I would say is it's important to really sort of look after yourself, make sure you get plenty of rest, and try and have at least one person who's available to sort of support you. And I think that's, to be honest with you, is probably the most important thing to get through an IVF cycle for egg freezing.
I love that.
Yeah, me
That's
too.
Such great
That's
advice.
really good advice, and it's so true. Like, it's from a patient perspective, you don't think about that before you're embarking on IVF. So for egg freezing, you're definitely not thinking that, because you're not thinking, infertile. You're not from that perspective. You're just thinking, oh, I'm doing this, and it'll be a walk in the park, and then I'll have some eggs frozen for security and whatnot. But yeah, you're not really thinking about the mental load and the stress that comes with that cycle.
And there's even just simple things like when people go home after the egg collection, whether or not they've had an anesthetic or a sedation, we still need someone to take them home and be with that person.
Yeah.
And most of the time when people are doing IVF with a partner, it's their partner that's taking them home. Whereas with egg freezing, some people don't have someone that's really able to sort of do that, particularly if they're not from, say, in my case, from Sydney, where, if they don't have family or really, really close friends here, then that can often be sort of quite difficult to have someone pick them up and then spend the evening.
Yeah. And it is isolating, and they're probably not telling anyone as well. So, yeah, I think all of that is so true.
Yeah, that's great advice.
Yeah. The next one, sorry, we're giving you all the hard ones today.
That's all right.
If you could tell every patient one brutal, honest truth about egg freezing, what would it be?
I said, unfortunately, we don't have a good test of egg quality at the moment. And our data would sort of suggest, so when people come back to use their eggs, which at this stage we have about 15% of women that are sort of coming back to use their eggs. But of those women who do come back to use their eggs, depending on what you read in the literature, somewhere between about 15 and 25% of patients won't get a single embryo for transfer out of their eggs thawed. And I think it's an important statistic, and it often makes people sort of stop and think, because I think if people thaw their eggs and they end up with an embryo or two and they don't fall pregnant, obviously that's upsetting, but people don't necessarily expect that egg freezing is a guarantee of success. But to do all of that and not even have a single attempt at trying to fall pregnant, so not a single embryo to go back, is really, really devastating. And as I said, that number is around about sort of 1 in 5. And what it probably is those people probably do actually have an underlying egg quality issue that we were never able to inform them about. And so when we've come to thaw their eggs and bring egg and sperm together, they have just not progressed nicely at all. And I think that that's just something that I think people just need to sort of understand, that it is one of the limits of egg freezing. We can't tell people about good or poor quality eggs, and there will be some people that will come back and they'll end up with a very poor outcome at the end. And often that's several years down the track, and often for those years they've been thinking, I've done my bit to preserve my fertility, it's going to be fine. And so to be then dealt that sort of news, as I said, it is very upsetting.
It's brutal.
I think it's good to know, though.
Yeah,
it's good to know, to weigh up, and I think everyone that does egg freezing needs to know that.
Yeah. Oh, absolutely. I feel like the talks of egg freezing is that it is, it is security, it is a insurance policy, and I mean, we know that IVF isn't guaranteed either. So that makes a lot of sense. To egg freezing would be a lot harder as well in that space. So yeah, I think if they get that advice straight up, then they can make a much more informed decision on whether, do they.
And maybe they'll still go ahead with it, but they just want to mentally prepare. Yeah. So then when they go through the process later on to make embryos, their expectation isn't so high. Because I think they'll still be willing to go through it. It's like IVF. You're willing to go through another round, but you just want to know, the stats or whatever it is for yourself. So, yeah.
Or it might hurry along a couple that are thinking we just want a bit more time to maybe have those hard conversations, that maybe it's better to, try.
Pull the trigger.
Literally. Yeah, pull the trigger.
Okay, next question. If someone is on the fence about egg freezing, what is the most honest advice you'd give them?
So I think it is important to have a conversation with an experienced fertility specialist. So someone who sort of has done a reasonable amount of sort of egg freezing. I think it's really important to know what your ovarian reserve is from a numbers perspective, so you can sort of have some idea in expected sort of outcomes. I think it's really important to understand, as said, the impact of age and fertility, what's involved in the egg freezing process and the success rates, and then also just relate that to, I suppose, what the person's sort of life goals are, and I suppose understand that may change. Like you do get lots of people where, and it can go both ways. Some people think, I really want to have a large family, and then they have, 1 or 2 children, and they're like, that's it, I'm done. Or some people want a large family, but they have to go through, IVF, and it's a struggle, and so then they readjust based on that. And likewise, there are other people that think, I want to have a small child, but then, they meet a partner that wants to have a large family. And, so all these things are constantly changing. But I think as I said, it's as much knowledge as you can possibly get in regards to the process and the success rate. And then try and get as much information as possible in regards to, the age, fertility, potential sort of success rates, and exactly sort of what's sort of involved in the process. I think that's sort of really sort of, really sort of quite important in terms of trying to make that decision in regards to whether or not they're going to go ahead and do egg freezing or not.
Yeah, I think that's a really good message, because I feel like when you start, whether it be egg freezing or for us IVF, I just thought about like the next step, and I didn't really think about the whole, I want 2 kids, I want 4 kids, or and what that time, I think time was the biggest thing that we learnt later, that, in hindsight, you want 2 kids, but it might take you 3 years to have one, and then, then you've got to factor in that and where you'll be for a fertility
because I think you can think, I want to freeze my eggs, but what does that mean? How many kids do you want?
Yeah.
You know what I mean?
Yeah,
so
you've got to
it's
plan.
such a good point. It's you have to think about those things for sure. So I think that's really important. For any of the listeners that maybe want to reach out and have a conversation with you, where can they best find you?
My main rooms are here at Genea Kent Street in Sydney. I also sort of consult at St Leonard's on Thursdays. So the easiest thing is either to get online or to call up the rooms.
We'll put all the links in the show notes.
And we'll link everything below for that as well.
Absolutely.
Yeah. But thank you so much for coming on, Dr. Anthony Marren. I've learned a lot today.
Me too.
All these episodes, I thought I wasn't going to learn too much, but I've learned a lot.
That's what happens when we do a whole segment on one topic, like egg freezing. So we've learned heaps.
Exactly.
That's pretty good.
We haven't actually touched on this episode in full before, and it's been requested. So I'm so glad we've covered this topic for anyone thinking about egg freezing. There's a bit more information and detail in there, and you've answered the questions really well. So we appreciate that.
Yeah, we appreciate your time too. We know that the office is trying to kick you out.
Yes,
lights off. So thank you.
No problems. Thank you very much.
Thank you, everyone.
Thank you. We'll see you next week.
Bye.
Bye.